actually give any medications to dogs or cats. They are sitting there on their own accord. And actually, truthfully, once I put all their needles in, a lot of times the dogs will get up and they'll walk around the exam room and they'll sniff things and they'll decide to lay back down on their own accord when they can feel like they can feel themselves feeling sleepy or resting, and they'll lay down and I have to wake them up. It's time to go home now, So, I don't restrain, I don't give drugs. And if I did have to give drugs, then I personally feel that I've lost my application for acupuncture, because I can't have that energetic innervation if they're on medications, if they're on sedations or dissociatives, or but I will do electrical stim if they're under anesthesia, like they're getting their mouths worked on and they've got a bunch of teeth that come out. Then I might run some needles through here to try and down regulate some of those pain receptors.
Okay, thank you, doctor. Somebody has asked that after an acupuncture treatment, can there be reoccurrence of that illness as in the case of chemotherapy?
I think I heard in the case of acupuncture, is there something
reoccurrence?
Oh, sure. I mean, just like life, right? Like I can make you feel better, and you can go outside and decide that you're 2 years old now and go run down the street and forget that you're not 2, you're 12, and it still hurts. And so, yeah, there are patients that I treat, every couple of weeks because they're old and they need help. And then there's patients that do the silly thing, like jump off of the deck, and now they hurt, and then they make them feel better and they go back to life, and I don't see them for years.
Okay, thank you. I wanted to ask that, have you ever had like a patient that was kind of like restless, and how were you kind of like able to handle that kind of patient?
Peanut butter. Peanut butter. Peanut butter.
How?
On a paper plate, and we smear it all over, and I hold it right in their face. And usually the owner will hold it there, and the dogs will lick the peanut butter while I put all my needles in.
Wow.
Or cheese or snacks or whatever they want.
Wow, that's so cool. I've never heard of that before.
Yeah. We actually have these little, they're little suction cup mats, and I can stick them on the wall. And then I can put peanut butter on that mat, and then the dogs will focus there while I do all my thing. So.
That's really nice. Guys, if you have any more questions, you can drop it in the chat box or unmute yourself and ask your questions. Thank you. So we'll just wait a few minutes and see if any other person has like a question to ask. Then I don't know if you have like maybe a video like that you could maybe share with us and we could see.
I can try. So there's some things I'm really good at, and there are some things I'm not good at. Actually, working the technology is not my favorite place.
It's okay. I think you're doing great. Yeah, we can see it. Oh, wow. I actually see the needles. Thank you. I hope
that dog's name his name is Kisses, that dog.
That's nice. You must get a lot of kisses. Somebody else asked that is acupuncture mainly for old animals or any animal with a problem? Is it age specific?
Good question. I will say that I got into acupuncture mostly for old animals because I love old dogs and cats. They're kind of my favorite group, right? but I treat a lot of young dogs and some cats for acute injuries, like blowing their knees when they blow their cruciate ligament. Then they need help, and I'll treat those guys. Or a lot of working dogs. I see dogs who are herding sheep or work cattle. We'll treat those guys for injuries, and they're young. Uh, and there are practitioners in my field who only do injuries for sports injuries. So dogs who are sporting dogs or show dogs or something like that. I actually tend to have an affinity for the old dogs. That's just about me, but you can do it on any age group. And you can do it on llamas and sheep and cows and horses and pigs even. So there, and like in our field, organic medicine is really important. And so it's a way to treat things without having to use a lot of drugs.
Okay, I have one question. Is there like maybe sizes for the needles? Because I know you kind of like mentioned horses. So is it like the same?
Yeah,
Different sizes?
absolutely. And to be honest with you, I just ordered a box of the wrong size needles. They're big. They're really long. They're like inches long instead of, half an inch long. And they are bigger in their gauge. So like you would know a traditional injection is 22 gauge needles. My acupuncture needles are like 30, maybe even higher, like 34 gauge needles. Whereas a horse needle might be down into the 22 gauge size, right? So yeah, definitely different sizes for different lengths. And in my world, if I have a very hairy, furry dog, I need something that weighs a little bit more so that the hair doesn't move the needle out before I'm ready. And if I have a very sensitive animal, I might grab a very small needle. Yeah.
Thank you. Somebody said that, do you need to see the same acupuncturist every time?
I think it depends. I think it's a little bit like finding the right doctor for yourself, somebody who listens to you and somebody that makes a difference in your patient, right? So if I'm treating this patient and I'm not getting good response, then it would be important to try a different acupuncturist, somebody who might see things differently. And in my field, we have to give them a Chinese diagnosis. So if I get that diagnosis wrong, I'm picking points for the wrong condition. Yeah, I think it's important, just like we would for us. Let's go find somebody that works for you. So yeah, or you can stay with the same one because you're getting good response and everything works well for you.
Thank you. Somebody said that, would acupuncture be considered cheaper and efficient than the normal traditional veterinary practice?
I think what you said was, is it cheaper, and would we use it more because it's cheaper? And I think probably has a lot to do with the finances of the family, right? In my area, it's actually cheaper to use Western medication. To go and grab a pill might be cheaper than to get acupuncture. But in other places, acupuncture is cheaper because the needles are cheap, right? So financially, I think it depends on that family and what their budget is and what they can do, and do they live 3 hours from me, and so gas being expensive, that's another thing, or do they live right around the corner and they can go to their family doctor, so
Okay,
yeah.
then I wanted to ask that, how long do you leave the needles inside the animal? Is there like a time frame, or it depends on how the animal is like responding?
Okay, and help me make sure I answer your question. So traditionally, we think 20 minutes, right? 20 minutes is how long I'd like to keep those needles in my patient. Cats are cats. Cats will tell you when they're done, and when they're done, they're done. You can't convince them anything different, right? So if I'm doing acupuncture in a cat, I have to listen to what they tell me, and they may say I get 5 minutes. Or they may fall asleep and we're there for 35 minutes, right? Dogs, it's a little bit more about how long they can sit still, right? So if they are only comfortable sitting still for 20 minutes, then 20 minutes is what I get. sometimes, like I said, they will fall asleep, or they're so happy to be eating peanut butter and relaxing that they will be there all day. I have to kind of kick them out. So kind of depends.
Thank you. Okay, guys, do you have any more questions? Okay, somebody said the probability of getting into the nerve, does it always depend on the level of expertise, or are there always specific areas? Like,
I think that I think the question is, I would never ever want to put a needle into a nerve. It's a quick way to get myself bit, right? For a dog to bite me because I hurt him, right? I might go near that area, and also recognizing that this needle is only maybe an inch long. And so there's not a lot of places on our body that that nerve is so close to the outside, except for like when we're doing elbows. If you go into that point between your two prominences here, you gotta lay your needle down very shallow and go through the skin versus straight down. And I would not want to tap a needle into a nerve. I would do damage that way. Was that the question?
yes, thank you.
Okay.
Can the process be repeated when the rate of response is slow?
Can you say that again?
Can the process be repeated when the rate of response is slow?
Absolutely. Yeah, absolutely. And I'm pretty impatient. I'm a kind of a type A person, and I want it to show me response, and I kind of want it now. So sometimes I have to calm down and know that they've been paralyzed now for 2 years. I can't expect one treatment to make them walk again. I might have to actually do it a few times. And sometimes I might do it 5 or 6 times and get no response and realize that this isn't a tool that's going to work for me. So yeah, I agree. Sometimes I can't get it to work.
Okay, so I don't know if you have like let's say, or if you know of like, let's say, a website that we can kind of like find more information about acupuncture.
Absolutely. So here in the US, we have a acupuncture societies. There's an actual veterinary acupuncture society that we use. It's called International Veterinary Acupuncture Society. And then there's the Chi Institute, which is in Florida. If you look up under Chi, CHI Institute, that's a great one. There's also a lot of like Colorado State has a great acupuncture website. So there's many, and in the United States, there's a holistic veterinary medical association. So if you want to learn about acupuncture, you want to learn about chiropractic or herbs or something like that, that's an umbrella for all of those training modules.
Okay, thank you. Somebody said that after acupuncture, what should be done to the pets, and what should the pets avoid, like post acupuncture? Are there maybe some things we should kind of like avoid, or we need to advise the clients to be aware of?
Right? Good question. So the most important thing there is that we tell those clients that a lot of times they're going to feel really good after treatment. That does not mean that they should go run a marathon. If they couldn't run the marathon before treatment, they shouldn't do it after treatment. And also these dogs who think that they are back to their youthful vigor, they can't jump off the couch. That's going to hurt them again, right? So we just want to reinforce those things that were not safe before are still not safe. So, and also, I also warn them about those dogs who might go home and sleep for 24 hours so that people don't get worried if that happens. So, and then we also encourage people to do things like if your neck hurts, bring the food dish up. If it hurts to go down the stairs, build a ramp. just other ways so that they don't get back into that and have to come back to me again. I need to help them prevent that injury.
Okay, thank you. Then before you actually start the process, are there some things you have to do, yeah, are there some things you have to do or things you have to consider?
Yep. So here in America, you are not, as a veterinarian, once you're a veterinarian, you're not required to pass training in order to do acupuncture. But we really do recommend that, because it's not like something you can just learn from a book and then just go and do. Most of my training, like my first training, was 160 hours of CE. So a very big amount of training went into that. It took me almost 10 months to get certified in acupuncture. And then after that, I might go and take, an online course and learn. So I just finished this course. This is an integrative approach to neurology. And that course took me about 40 working hours to do. And it takes all of it. You learn it again from the ground up. Like, if you have a bad back, here's some points to consider. Here's your therapy. So yeah. And then we take classes and we take tests after that. And if you pass that test, you can now earn that certification.
Okay, thank you. Okay. If you have any more questions, please drop it in the chat. We'll soon end the session. So in the next few minutes, I wanted to ask, like, for instance, in surgery, when we want to kind of like do surgery, we have to sometimes shave, then disinfect the area before we actually start the surgery. So do we have to maybe shave the animal, or there's no need for that?
No need for that at all.
Okay.
Nope. Yep. And the only reason I might shave is because I want an owner to know where they do pressure, right? More like a roadmap for the client, but not for us. Fingers.
Okay. All right. Would wait just one more minute to see if any other person has any questions. If not, we would end this session.
Okay.
In the meantime, thank you so much for accepting our invite. I really learned a lot. To be honest with you, I had no idea. I didn't have any idea of what acupuncture was about. I was discussing with one of my lecturers who was like, oh, that somebody that is like very good in acupuncture. And that actually prompted me to go and check the meaning of what acupuncture was in the dictionary. So basically, the only thing I knew about it was like, okay, the definition. But this webinar has given me great insight into what it entails. And I'm sure everybody that is here today has learned one or two things about it. So thank you so much, Dr. Kim.
Very welcome. Thank you.
Yeah, in the absence of no questions, we would end the session now, and we wish you a very lovely day.
And I hope you have a nice afternoon.
Yeah, thank you.